Hi, Chris Westphal. A lot of things new in the Medicare world. You know, I don't intentionally try to offend people, but today I probably will. And been doing this for 27 years. I'm an independent broker. If you want to reach us, our contact information is in the description below. But what is new with Medicare? Actually, it turns out a lot of things are new. And if you're on a Medicare supplement or considering one, or Medicare Advantage plan, want to know what's happening in the industry, this is the channel for you to subscribe to. For instance, if you're on a Cigna Medicare supplement and you happen to have the Cigna brand of 𝗃, they call it 𝗃 for some reason. It's Cigna Health and Life Insurance Company. That's one of the many brands that Cigna has as a Medicare supplement. It's called Cigna Health and Life Insurance Company. If you have that one, potentially some big changes may be coming your way. You'll get a notice from the company soon. And we've highlighted this on our website just to make it easy and show you what your options are and potentially review the whole marketplace, because that's what we can do as an independent broker. But it's important that you know what's going on. I'm going to show you that here in just a second. Also, Prosperity Life doing the same thing, going to a closed risk pool, not selling anymore. How does that affect you? Well, I explain it in detail on our website and give you options, that things you can look at. Then U.S. Fire Medicare Supplement, same thing happening here, going to a closed risk pool. What's involved? Well, hopefully you're working with an independent broker that stays up on the news, communicates with you when it's affecting you, and gives you alternatives if things like this happen. Then we're going to take a look at the rate increases happening with Medicare Supplement, Plan G, and Plan N, and why that might be an important consideration. First, this just happened in the news, announced that Cigna is being sued again on the Medicare Advantage side, not Medicare Supplement, but the Medicare Advantage side. It says Cigna was hit with another consumer class action after its algorithm to evaluate medical claims, again, Medicare Advantage only, allegedly automatically denied more than 300,000 requests without manual review. The plaintiff brought the action against Cigna and Cigna Health and Life Insurance Company in Connecticut Federal Court, which is where they are. And how does that impact you? Maybe not, but we'll stay on top of it. In other Cigna news, they did announce that they're going to sell their company to HCSC. It's a Blue Cross affiliate, primarily in the central north. And they're going to sell it all. Medicare Advantage, Medicare Supplement, the Part D, all of it's going to be in one thing. So Cigna sent this letter. They're sending this letter. They're going to send this letter, depending on where you are, from their one brand, Cigna Health and Life Insurance Company. If you're on that one brand, you may see a letter similar to this. They're changing all the people from this company to this company. What does that matter to you? Not a bit. Nothing's changing right now, except to know that this is going to be a closed risk pool, which means no new people can come into the risk pool, which is not a good place to be if you can avoid it. That means that nobody young, nobody new to Medicare, nobody that got through underwriting are going to be joining anymore to keep the overall average rate increases and the impact of claims low. Instead of going from this closed risk pool, they're going to move you now to a Medco. I spelled that wrong. It's Medco, not Medico. There's already a different Medico, and that's why I got confused. No confusion there. But this other company is also going to be a closed risk pool. So you don't want to be in this one if it's closed, and I'm thinking you might not want to be in this one if it's closed. Anyway, we have options and updates on that at this website. The description will also have the link if you want to find out what's going on and how it may impact you. Similarly, Prosperity Life just announced in this letter going out to all the clients, they're just not going to sell anymore, period. So they're pulling the plug on any new people coming in. And it says, since your policy is guarantee renewable, you will retain your coverage by paying your premiums when you're due. However, with no new sales of this product, future rate increases may be greater than they would have been if sales of this product had continued. That is rare honesty in the insurance world. And so it says here, right here, this will create a closed block of business. Same thing happening here, but here they're telling you right off the bat that future rate increases are going to be impacted in a potentially negative way. So you need alternatives. If you don't know who your agent is, I have a good recommendation on one that can help you. That would be us. Similarly, U.S. Fire has announced they're going to discontinue the sale of new policies, causing the existing ones to be in a closed risk pool. Still keep the plan. They can't go anywhere as long as you pay the premium. So don't freak out thinking you're going to lose your Medicare supplement. That never happens. You will keep your Medicare supplement. What I'm concerned about is the potential for future rate increases. And that's why we're communicating with our existing clients and giving them options as to where to go. I did an article. Well, I didn't do an article. I was quoted in an article in Newsweek talking about the impact of government regulation when it's coming down on insurance companies, telling them you have to do more things for consumers. Now, states like New York, California, Washington State, many states now, they have rules in place, like on the Medicare supplement side, saying you have to give everybody a chance to get a Medicare supplement, like New York, for instance. What does that do? Well, the insurance companies say, well, we can't make any money then. We're just going to close up shop and leave the state. Or we could raise our rates to offset what you just required us to take, which is anybody and everybody in New York. That's why the rates are 3 to 4 times higher than like in my state in South Carolina. We write business all across the country, so we see the impact on our existing clients when states pass laws like this. Recent additions include Oklahoma, Maryland, Illinois. States are adding these guarantee issue provisions, and they just think it won't impact the consumer in a negative way. It'll be good because more people can change their Medicare supplement in case they get stuck with one. They just don't realize the impact of what that's going to do to people. And that's what I covered in my interview with Newsweek about that. And this one's talking about the Inflation Reduction Act and the fact that there will be a cap, a max out of pocket on drugs starting in 2025. Sounds like a fantastic thing, but the insurance companies are freaking out about it, looking at every possible way that they can get that money back. And who do they get the money back from? They don't get it from the government. They get it from you. So you can expect smaller formularies, increased utilization management, which means trying to keep you from getting what you need, and rate increases on the premiums on Part D drug plans. All those things are happening. Why? Because the insurance companies are not in business to lose money. They have to at least break even. And when the government comes out and says, you're going to do this, you're going to give away stuff for free to people, then it's going to come back and it's going to bite them. Anyway, you can read that article. I'll link to it below. Oh, and this is interesting. The Medicare Rights Center, right after I did that interview, the next day literally came out with a report saying exactly the same conclusion that I said. The California report that they were citing says the Inflation Reduction Act is changing the structure of Part D payments and plan liabilities. Yeah, they're liable for that max out of pocket. If plan cost increase as a result of the IRA, the plans may respond by pursuing savings elsewhere, including through more aggressive use of formulary exclusions, prior authorization, and step therapy. Exactly what I said would happen, but I didn't need to do a study to figure that out. Now I want to talk about those folks that are out there on the interwebs, and they're yelling and yelling about they want you to sign up for Plan G Medicare Supplement, and only Plan G. And I want you to just ask yourself, why is that? What is the financial incentive possibly for in the Medicare supplement world, just talking about Plan G and nothing else? And you'll see them on the internet. They're talking about, yeah, we'll tell you about Plan N, but simply Plan G is just better. Is it a little bit more money? Yeah, but it's better. So my question is, if I want to be in this business for a long time, and I've only been doing it for 27 years now, but I'm starting to get the hang of it. If I want to be in business for a long time, do I just want to shout, sign up for the simple plan, get off the phone with me because it's too simple to explain. There's a deductible, everything else is paid. A little bit more money, but no big deal. Or do I want to consistently keep the same clients that I've had for the last 20 years by telling them the whole story? And that's why you're watching this YouTube channel. Let me show you an example. The long-term trend, how does it affect you? That's a big deal if you're going to be on Medicare for the next 5 years at least. Well, let's look at some of the rate increase notices that I've been chronicling. That's a long word. Since 2020, we started following MACRA in 2018 when that bill was passed. And that's when they made Plan G the dominant recipient of all guarantee issue business. All the people with special election periods, when they're dumped from other plans like Medicaid, Medicare Advantage, they lose those plans through no fault of their own. They're allowed to get one plan now without any underwriting whatsoever. What does that mean? It means that your insurance company is going to take it on the chin by a government mandate that says that they've got to take these people. They're not new to Medicare by being 65. And no, they're not going through underwriting questions to know that they're going to be healthy to join you in that risk pool. No, they're having to take these people. They just have to take them. And where are those people dumped into that you can benefit from, whether they're healthy or not? Most likely not. They're dumped into Plan G. What does that mean to you? It means long-term, the rates are going to go up based on the experience of the people in that plan. So if you're looking long-term, you better look at the other options out there. And for the agents, might want to take the time to explain that plan that has those super complicated copays, which is not complicated at all. It's up to $20. Most of our clients report it's about $12 to $14 is the copay when they go to the doctor. Is that a big deal? No, it's not. Now, look, if you go to the doctor already, you're brand new to Medicare, and you tell me, I go to the doctor 5 to 10 times a month. Yes, Plan G is going to be the way for you. So I'm not saying Plan N is the same for everybody. It's the best thing for everybody. But I want you to look at what we see behind the scenes. That's why I'm sharing this with you and making more people angry. It's true. These are rate increase notices from a variety of different insurance companies over the last 3 to 4 years. Please look at the difference. These are my same neighbors that signed up just for one plan versus another. And then consider the impact of a long-term trend just like this. How many years could you continue to pay your Medicare supplement premium if you knew that you're going to have to pay 18% increases every single year? Maybe not many. So in the past, like here's an example, South Carolina had an 18% rate increase while the exact same time was announced 5% for Plan N, 15% in Utah, but Plan N 0, because the people in Plan N are healthier. One, because there's no guarantee issue people in there, and there never will be. Two, because they have to pay a copay before they go to the doctor. What does that do? Has a small psychological speed bump to go into the doctor. I'm going to have to pull out my wallet and pay a small copay. Do I really want to do it, or can I go another day with my cold? That little speed bump is what Joe Lieberman identified in his testimony to Congress in 2018, talking about MACRA, when he said, we need to get rid of that Plan F. That Plan F Medicare supplement pays for everything, not even a deductible, pays for everything. So people are using it like crazy. They're abusing the system. So they got rid of Plan F. As of 2020, you can't have Plan F anymore. Why? Because of the overutilization of having nothing in the way of you going to the doctor for every little thing. Multiply that times millions of people, and it affects the rates. It really does. So again, I want you to see what's going on in the world with the rates. Let's look at a real example. This is my backyard, Mount Pleasant, South Carolina. I'm looking at a 65-year-old female. She's brand new to Medicare. First time, the world is her oyster, and she comes to me for help. Now, I can sell all these different plans because I'm an independent broker. But if all things are equal, if the company's good, if the customer service is good, if they've got good administration, and all things are equal, I'm going to go for the lowest rate, aren't you? Because Plan G is a Plan G is a Plan G. Doesn't matter. So I'd probably go with ACE right in this case. Now, these rates are going to be different depending on where you live. I know a lot of the comments will say, I wish I had a rate that low. Well, this is only in one particular zip code. Happens to be my backyard. I didn't pick it for any other reason. Just an example. Please follow along just for the example here. 101.33 for a person brand new to Medicare. 101.33 for Plan G. Now, if those the other agents out there just yelling and screaming about Plan G, this is what I'd sell you. Now I'd be off the phone quick because I wouldn't have to explain Plan N. However, Plan N, if somebody like me in my office explained it to you, we would tell you about this one. We would ask you, how many times do you go to the doctor now? How many times do you think you'll go to the doctor next year? Okay, well, the differential there being 25% savings, let's multiply these savings over a year. Then let's subtract the worst case scenario of how many doctor visits you would have at, let's say, $20 per office visit. In most every case, Plan N still makes the best choice for today. But again, we're not looking at today. We're looking at long term. What's it going to do long term? I'm not the one yelling Plan G. I want you to see both, and here's why. The commission that I make on a Plan G in this very case would be $22.29 per month, residual income. That's why people love the Medicare business, because we get paid every month that you pay the premium. By the way, people say, how do you get paid? We get paid by the insurance company when you sign up. It doesn't cost anything to work with us. And this money, this commission, is built into the rate whether you went to direct the insurance company or you let somebody help you and shop the entire market for you every year, like we do. So you're not going to get a cheaper plan by going direct to an insurance company. You pay the exact same rate. It's just the insurance company makes more because they don't have to pay us. Anyway, I digress. So up here, you've got Plan G paying me $22 a month. And I have Plan N down here that would have been paying me 25% less. But if you've got any kind of a business operation and you've got people selling with you in your office and you're building a team and you're marketing to more than just your backyard, and let's say you have a successful YouTube channel with a couple 100,000 people that are subscribers, and you push everybody on one plan, that differential becomes way bigger when you're looking at just 1,000 clients. Looking at 1,000 clients, I would make $267,000 a year from that, or 207. That's a big difference. So I just got a raise of 25%. Now, that's what it means to me. And I wanted you to know that in full transparency. This is why agents hate me. I'm okay with that because I like to be the one that tells the whole story. Here's how it impacts you. A couple more examples. This is 2022 Plan G announcement, Plan N announcement. 9% or 0. You pick your plan. Plan G 8 and 14 or 0 and 4. Pick your plan. But more and more, I've got all these examples at planandmedicare.org. So right off the bat, you're paying less. But what about 5 years later? Could you afford to pay 50% more from the plan that you're signing up with today, 5 years from now, and you'll look back and curse the agent that put you on that plan because he never looked long term? So I encourage you, if you want to use somebody that you find more appealing, maybe they dress really well and they can talk really, really fast, and it looks like they're drawing on something that just makes a lot of sense for them. I just want to encourage you to ask this question. What does your recommendation do to me long term? 5 years from now, where do you see this? And they'll probably come back with, oh, past performance is no indication of future performance. We don't really know, but it's simple. Sign up for this Plan G. So I want my customers to still be with me 5 and 10 years from now. You're going to ask the question, can I just change my Medicare plan anytime? And some agents will tell you, yeah, you can renew with a different insurance company. Just sign up for a different Medicare supplement company. If you get a big rate increase, we'll be here. We'll shop the market for you if you can qualify through underwriting. Or if you're one of the lucky few that are in those states that have a birthday rule or an anniversary rule or a guarantee issue rule, yes. But for the vast majority of other states, you may be stuck on your plan and you can't get off of it because your health then changes. Sometime in the next 5 years, your warranty on your knee or your heart or with diabetes might expire, and you might not be able to switch plans. That's why we want to look long-term. We want to look at what's the best plan, not just for today, but long-term for your life. That's why I wanted to tell you the truth. And if you want to see more, you can go to planandmedicare.org and you can see all the research and you can see the explanation of Plan N. I want to share with you something that was just put out. It was a video done by Los Angeles hospitals talking about Medicare Advantage. This is fascinating. It just hit the internet. Check this out.
My dad needed intensive rehabilitative services after an amputation. Medicare rules and his doctors said he qualified for it. His giant insurance company blocked his needed care without ever laying eyes on him. Rather than going home today, he's stuck at a nursing home with his health declining. We need federal leaders to start enforcing the rules that protect patients like my dad.
Hospital Association. Oh, it's LA, the other LA. But check this out.
Do we need to have advertisements on buses for traditional Medicare? Like, do we need to have agents for traditional Medicare? Because, I mean, is that part of an even playing field? Should we just assume that, to John's point, like, the beneficiaries are going to find their way to the right plan here? Or is the environment such that it's, even from a marketing information perspective, skewed so much towards MA that some sort of equal and opposite intervention is required as part of this evening?
I don't know about the traditional Medicare advertising, but I will say I think there are things you can do even on the Medicare Advantage side to limit some of that more. And the administration has taken some steps to do this and to regulate marketing. I think there's ways in which they could go further. Like, for example, in the most recent proposed rule for Medicare Advantage, there are limits to the broker and agent compensation in Medicare Advantage. It doesn't affect what they're paying on the traditional Medicare side, and most agents and brokers are still making much less for enrolling people in Medigap in traditional Medicare than in Medicare Advantage.
Wait, what did she just say? She's a PhD and figured all this stuff out, but she's not a broker. She's not trying to sell you anything, but please listen to what she just said.
And most agents and brokers are still making much less for enrolling people in Medigap in traditional Medicare than in Medicare Advantage. And so there are some steps that you could do to go further, even through Medicare Advantage regulations, I think, around marketing, around agent and broker compensation, to kind of level the playing field on some of this.
So that might be dialing down MA rather than dialing up TM, so to speak.
Yeah.
Dialing down Medicare Advantage marketing is what they're talking about. This is a symposium done by Brown University and published this week online, talking about healthcare policy, specifically about Medicare Advantage and the many things that are wrong with Medicare Advantage and how they can better get coverage for the people that are on original Medicare, and heck, even get better coverage for the people on Medicare Advantage. And she points to the thing that I've been saying that other agents are freaking out about, because I brought it up, that we make more money when we sign up somebody for a Medicare Advantage plan. That's why I could not sleep at night if I just signed up people for Medicare Advantage, if I'd never told them about Medicare Supplement. If you don't know the difference, I'll explain it here in just a minute. But most agents and brokers out there are not telling the story about Medicare supplements at all. They're not telling you that you could have original Medicare. It's just not part of what they do. They think Medicare Advantage is everything out there. And it's not, and it could harm you. Here's an example from the same symposium at Brown University.
Brown, I'm currently a law professor at Georgia State University College of Law, but there are several opportunities from a policy standpoint to improve Medicare Advantage, both to save money and support the sustainability of the Medicare program overall, as well as to improve the experience of the Medicare beneficiaries who are relying on these programs for their care. So if the goal is to improve the experience of beneficiaries, which I think has to be certainly part of any policy goal, is to focus on the experience of the beneficiary. One would be to improve the transparency that we have been hearing about and oversight over the value of these supplemental benefits. What does it mean to sell a plan that has a vision benefit? And I was just talking to my sister-in-law who was saying that under her Medicare Advantage plan, she said, I got vision. It's so great. And I was like, so she's like, and I need to go to the eye doctor. And I said, so what's prevented you from going to the eye doctor? She says, well, it's the nearest eye doctor who will take my plan is 50 miles away. And she's like, I can't drive 50 miles to go to the eye doctor. Like, that's just not an option. So for her, she might as well not have a vision benefit. And in the span of having this conversation, we drove by like 3 optometrists, but none of them were in her network, so she could not actually access this. So what is the value of these benefits? How much are they being used? What is the actuarial value of these benefits, let alone their network quality? So that would be one thing to study. Again, we've heard a lot from Medicare beneficiaries about frustrations with prior authorization and the rate of denials, and just knowing, again, how often are there differential, are plans doing prior authorization denials at different rates? We hear that, anecdotally, it seems to be the case, and whether they are, and how much of a burden does that place on the beneficiary, and when does it actually prevent them from accessing needed care? And another thing we would want to know is the fees and commissions that brokers and marketing agents are making on the backs of sort of pulling people into signing people up for Medicare Advantage plans that may not actually be the best for them, and what are their financial incentives, and to what degree are these payments sort of steering people and affecting their choices and their outcomes. And finally, there's this whole idea of once you're in, if you're a Medicare beneficiary into Medicare Advantage, are you giving up the possibility of ever switching to traditional Medicare? Because even if it somehow stops serving your needs, or you wake up and realize I probably would be better off with a traditional Medicare, but I now can't afford a Medigap plan. Why? Because my diagnoses have been coded so intensively over the past few years, and now that I go and try to shop for a Medigap plan, which are not community rated, I am priced out, and I simply cannot afford a Medigap plan. And so in most states, that's the case. And so, are there real barriers in terms of the lived experience for the Medicare beneficiary? And there are a lot of things we could do to improve the experience. Again, a lot of it just starts with transparency.
Transparency. That's why I'm doing this channel. That's why I'm here. Because before I was talking about things like brokers being paid too much, prior authorizations and how it's actually killing people and the rest, things like this, like that lawyer was just not out there. It's just not being put in the public sphere. So that's why I'm doing it, folks. If you're not already aware, there are two different kinds of ways you can go with Medicare. I really encourage you to read the Medicare and You guidebook that you probably received in the mail. It looks something like that. And when you're new to Medicare, you can get it. If you're not new to Medicare, you can still get it by just asking for your copy from Medicare.gov. You can also open it online, the PDF version of it, and then you can search for anything you want to in there real easy by doing on your keyboard Control F. That's the find feature in Adobe Acrobat or the readers. Control F, and you can find where they're talking about whatever you want to talk about with Medicare. But anyway, on Medicare, you've got Original Medicare, which is any hospital, any doctor in America that accepts Medicare, which is most all of them. You can go to any of them. You don't need a referral. You don't need prior authorization, except in the high utilization fraud areas like durable medical equipment. That's Original Medicare. Freedom. That should be your choice, and agents should tell you about that. But all they do is talk about Medicare Advantage, where you have, in most all cases, a network, a very limited network that you can go to. That does change. It's not going to stay the same network depending on what you wanted it to be when you signed up or what you signed up for because they told you that's what it was. It can change all year long. You have to get referrals to see most specialists. You have to get prior authorization to get anything done that costs money. With those, as a broker, I can tell you, it's a good idea to get one of these things to supplement either way to go. On Original Medicare, you should get a Medicare Supplement plan. We just talked about two of them in great detail. You can find out more information through my videos, website, or sign up so we can tell you on an appointment what those are and which one may be best for you. But if you're on a Medicare Advantage plan, paying zero premium like so many are, and one day, hopefully, you'll never find out what's behind it if you actually need to use it. There's so many more news articles to cover on this that I'll be bringing to you soon, but you need a cancer insurance plan. If you're in a state that allows you to buy one, you need cancer insurance to go with Medicare Advantage. You really, really do. If you don't believe me, please look at your summary of benefits, the SOB, on your Medicare Advantage plan and see what it's going to cost you if you need cancer treatment, radiation therapy, chemotherapy. In most all cases, you're going to see that you have to pay 20% of that big bill. That's if you can find the treatment in the limited network of oncology that they have in your plan. You have to pay 20%. Oh, but I have a max out of pocket. Your max out of pocket only covers you up to the point that they've authorized the treatment. If they don't authorize it and you go somewhere else, or you can't find an oncologist and you don't go to their doctor, you go outside, they don't cover anything. And your max out of pocket resets again and again and again every year. You have to pay it again. So you need cancer insurance. Cash value cancer insurance just pays you the cash immediately. And I would suggest in many cases, if you have a high hospital copay, like $500, $750 per day to go in the hospital, times 5 days, that could really impact you. Where for a very small amount of money, a hospital indemnity plan can cover that for you, especially if you're just paying zero every month. Woo! I've covered a lot here today, and boy, we have a lot more to cover. My name's Chris Westphal. You can scan that little QR code there, and that will help you contact us, or you can call our 800 number. But the best way, the easiest way to reach us is on the website. Why? Because on the website, you can book an appointment. And if you make an appointment, we will be there. And you can book an appointment 24 hours a day. You don't have to wait for somebody to call you back on the phone. So if we can help you in any way, please reach out and let us know. We would love to do that. Again, the best way to do it is by booking an appointment. God bless you. Thank you so much for watching. We'll see you next time.